Welcome back to First in Preparedness, and today we're going to continue on this journey of first aid kits. Now, in this kind of brief episode that we're going to have here, I'm going to cover some things not to buy or things that I think are a waste of money that I've wasted my money on. So I'm going to try to steer you in the right direction. Now, let's say you've bought an off-the-shelf first aid kit, much like this is here. Well, what you're going to have to do is you're probably going to have to supplement some items in order to enhance the scope of that first aid kit. Some of those items are sitting right here today. So let's get started on things that I think are a complete waste of money and things that I think you should actually buy and that are actually useful. So with that, let's take a look at each of these items. Okay, so let's get started with the first item I don't think you should waste your money on, and that would be this. Sutures. They're expensive. And think about it. I mean, unless you have like a significant store of lidocaine and you have practiced a tremendous amount of stitching people up, these are pretty much a complete waste of money. And think about it. If you don't have lidocaine and you try to stitch someone up, do you know how painful that is? I mean, aside from the biter that you have to open up the wound with and then actually slide a small blade through each side of the skin, that just doesn't sound like a whole lot of fun to me. So, if you're going to decide to try to pursue some way to suture a wound, I would suggest picking up one of these. Surgical stapler.
Yeah, I believe you have my stapler.
Heck of a lot faster, and if I'm going to go ahead and pierce my skin, I'd rather just get it done with a quick pop than have to endure somebody sliding a needle in and out of a wound. This is a heck of a lot quicker, it's over quick, and it also is much faster to actually close the wound up. And beyond that, if you don't want to even go this route, my strongest suggestion is pick up some of these steri strips. Now, in using steri strips, there's several videos out there. I'm not going to cover it, but make sure you degrease the skin around where the steri strips go. And I would actually suggest getting some sort of, they sell some tack wipes that actually make the skin more tacky, and these will actually stay on long enough to close a wound. So my best suggestion is just pick up some steri strips and use this for wound closure. Stay away from the sutures. Now, the next thing that you should supplement in your first aid kit is this, commonly known as Coban or vet wrap. You can pick like 12 of these things up for relatively cheap, and they are an invaluable bandage. Coban is probably one of the most amazing things ever invented for the medical industry, probably in the last, 15, 20 years. This stuff works tremendously well, and you should definitely supplement your first aid kit with this. Next thing you should buy is what's known as 3M Durapore. This stuff is known as kind of silk tape, I guess, is an industry standard. This tape is extremely durable when it's on you. I use it to wrap up cuts on my fingers. I'll actually tear it in half and actually make small strips and cover up fingertips, and the stuff will last an entire day. That's even with me working. So this is another item that's similar to kind of what Coban does, but it is extremely sticky and extremely durable. Next thing you should supplement your kit with is non-stick pads. Now, these come in two different sizes. I think this is a 3x4, so this is one of the larger ones, and they also come in 2x3. You can pick like 100 of these up for cheap. I mean, it might be $10, but you could supply several first aid kits if you pick up like 100 or 50 pack of these. Now, that's going to probably cause some upheaval. Well, maybe not, probably. But next thing you should get, if you pick up gauze sponges, go ahead and either just pick up the 4x4 or the 3x3. The 2x2s, I mean, these things are kind of worthless unless you work in a blood draw lab or something like that where you're going to wrap somebody's arm up after, because these things are so small, they don't really function for anything, especially if you have like a major wound. Instead, just worry about getting 4x4s or 3x3s. And once again, you can buy these in like 100 packs for next to nothing. So make sure you get your larger sponges. They just work better. They're more effective. The next thing you should supplement your first aid kits with are these triangle bandages. They come with, usually come with safety pins, and they are a large triangular bandage, and they serve several different purposes. I mean, these things have been used, I don't know, since Revolutionary War, actually, and they are very effective at arm slings, making wraps, head injuries. They just about work for anything, including a bandage. Now, they are, of course, non-sterile, but as far as, like I said, bracing an arm, bracing a knee, wrapping around your head, these things are invaluable. And you can also pick these things up for dirt cheap for like a pack of 12 of them. Next thing is a SAM splint. Now, these are probably more for mechanical injuries. They can basically kind of brace a broken leg or a broken arm, just like they have there in the picture. But it's good to have at least one of these around. This is a 36-inch. I have, I don't know, a bunch of these things sitting around, but these are good if you need to splint a broken bone or brace a sprain or something like that. A SAM splint is a good thing to supplement your first aid kit with. So there you have it, folks. Some extra items to supplement your off-the-shelf first aid kit. And like I said, these things basically expand the scope of what your first aid kit can do. When I dropped that air compressor on my toe, I basically took a non-stick 2x3 non-stick bandage and wrapped my toe up in Coban for about a week. It actually took a week for that thing to actually stop bleeding and settle in. I actually did not have to go to the hospital for it, and today, which is about a year and a half later, the nail has grown back. Good stuff, I'd say. So once again, thank you for tuning in here to First in Preparedness. And next week, I'm going to kind of go over a price list of each of these items here so that basically I can show you how to make 10 first aid kits that are actually pretty well stocked. Now, bear in mind, these are not trauma kits. These are not IFAKs. We'll get into that a little bit later on, but these little items here will basically maybe prevent you from having to go to the hospital and cost yourself a shit ton of money. So we know healthcare is not cheap, right? So with that, thanks again for tuning in. And of course, like and subscribe. I hate saying that. It's like solicitation of Jehovah's Witnesses at your door. But thanks for tuning in. We'll see you soon.